Now we're going to turn to the potential changes coming to your child's vaccination schedule. It's at the center of the latest CDC vaccine advisory panel meetings over the last few days. Our chief medical correspondent, Dr. Narula, is here with what we need to know about the flu shot, the RSV vaccine, Doc, and more. And what is this panel? And how might they influence vaccine policy?
Well, there's a lot of controversy right now because RFK eliminated the 17 original members of the panel and put into place 7 new members. Many in the scientific community worry about some of these new members in terms of their credentials and potential bias. So what does this panel do? Well, they make recommendations to the CDC. They meet several times a year. They review the evidence and data on vaccines. They vote, and then they pass those recommendations on to the CDC director, who essentially then decides if they're going to become policy. What do they look at? They look at who's going to get vaccines, when should they get vaccines, and which vaccines. They influence insurance companies in terms of which vaccines they will cover, federal government programs that give vaccines to uninsured or low-income children, states that make policies about what schools should have as their mandated vaccine entry policies, and doctors in terms of what we recommend in the office. So a lot comes out of this panel.
Yeah, it's a very, very big job, a lot of responsibility. So what did the panel vote on or discuss this week?
Well, the panel met for 2 days, and they basically said a couple things. They're going to be reviewing the timing of general vaccines, the number of vaccines, the ingredients, the cumulative effect of vaccines. So we'll look backwards at what is existing. They're also going to look at vaccines that have not been reviewed for the past 7 years. So in particular, the hepatitis B vaccine and the MMRV vaccine. In addition, they did approve an RSV shot for infants under 8 months whose mothers may not have been vaccinated during pregnancy. And they also said they will be removing or advising removal of thimerosal, which is a mercury preservative used in a few vaccines, about 4% of flu vaccines. Now, there has been no evidence to date that thimerosal does cause or is linked to autism or any neurodevelopmental disorders. That being said, has really been taken out of the vaccine supply for the most part.
Now, with everything going on, what's the biggest takeaway for parents?
I think we're in a really tough situation right now because parents rely on pediatricians and their advice. Pediatricians rely on the CDC. And now there's this divide. You have the CDC, you have this panel basically saying, look, we're going to review and make evidence-based recommendations. And you have people from the American Academy of Pediatrics saying, this panel is not credible. It is illegitimate. They did not attend the meeting. And in fact, they are going to create their own schedule of recommended vaccines. So where does that leave you and me, right, as parents? I think we're going to be confused as to what to do. There may be distrust. There may be really a concern about whether vaccines are safe. And that's not really what we need in this time. I think a lot of the burden is going to fall on pediatricians now to review the evidence, just like we do with sometimes differing screening recommendations. You have differing groups telling you start screening at this age or start screening at this age. And now that's what's going to happen. They're going to have to look at all these recs and figure out what to recommend to the patient and the family. Unfortunately, you and I know when you're in an office with a pediatrician, you're there for about 15 minutes. How do you summarize all of this?
They added another level to the pediatrician
Another level.
job.
And then you worry about the ripple effects on those states and schools and low income and kids who may not be able to access this.
Wow, Doc, thank you. I mean, very important issue, affecting a lot of families out there.
Hopefully we don't lose faith in science. That's
sure
my
hope
big
not.
takeaway.
It's gotten us this far and continues to advance for us all. Thank you so much for that, Doc.
Thank you, Michael.